Hello guys, my name is Dr. Varun and you are watching DentalWoes. I'm gonna be helping you out with the journal Pharmacology. So let's try together and try to make this subject to sound a something in our dental degrees. Well, anyone who is studying the journal Pharmacology can take the reference from this. Let's just start. So this is the first chapter, or in your books it is a journal sections related to it, where we're gonna be dividing the whole thing into multiple chapters. So one by one we are doing it. The book we are taking the reference is the very basic book, that is KT Tripathi book for the journal Pharmacology. So that book we are taking into reference format. So accordingly the chapter lineup will come up. Let's just start the first chapter, which is about the introductions to the journal pharmacological principles and the route of administration. So the chapter is divided. This video is divided into two parts. We're going to be completing both the parts in this only. Let's just start. First of all, introduction. So pharmacology. Well, I must ask you that what do we call that? Let's go to pharmacy. What does that mean? It is a place where you can get medicines, right? So that is what our terminologies that we have to understand. So certain terminologies are coming up in the introductions. So first is pharmacology. It is made up of two words, pharmacon and the logy. What does pharmacon means? Pharmacon means drugs. Drugs means what? Your medicines. Of course, we're gonna come up on the drug word as well, but let's just understand that where we can get the medicines. We can easily get the medicines at the pharmacy. That's why we used to say that Apollo pharmacy, these terms which you might have studied. Now let's go on. Locus means discurses. In means basically is to study. It is the thing which discussed or deal with the pharmacon, which is with the drugs, this branch. Now this branch, in the broad sense we have understood, means what? Exogenously means this will be related to exogenously at our level. Is what? Exogenously we're going to be giving certain drugs inside the body and make the patients undergo that like the reactions, so that it can get what? It can get healthy. So this is only, it has been written in the terminologies also, that it deals with the interaction of the exogenously administered chemicals. What are drugs? Like for example, if you get fever, you will give what? Paracetamol, PCM, 500 mg, 650 mg, depending upon the adult. Okay, very important. When I'm using certain terminologies, I'm using the terminologies for different type of patients also. So try to catch that as well. So you are giving that into what? A living system, your patient, or a single chemical substance which can produce a biological response is called as what? It is a drug that we're gonna be using. Okay, and it comprises of all the knowledge about the drug, this field that we are gonna be studying, and we have to even see that how effective a drug is, how safe a drug is, and how it is being metabolized in the body. So these all things is the part of it. Now if someone will ask like that, who was the first one who is like known as that this is the father of pharmacology? Father of pharmacology is the Oswald, this person. Okay, he worked on this field. Okay, but who established the first clinical institute, that too in 1847 in Germany, was the Rudolf. So this person is what? He made the first institute for the pharmacology, where the drug interactions to everything will take place. But who is the father? He is the father of the pharmacology. Not only this, but the others of its what we say that et al we used to write, means the people who follow or work under a research system. They like the Paul Enrich, you might have studied about that person earlier also, or heard about that person. He also was the part of it, but together they worked it, but he is what? The head over there. So from here I will let you know that when you will be working as a PG, any one of you who want to be doing the PG in your field, then you will have what? You will have a guide. The guide name would be the main thing, or if you are uploading anything, the guide would be the one and you are the part of it. Research would be your, but the credit would be your guides. Okay, so this thing also happened in this field. So the other person with the Oswalds who were there, they were the part of their journey, or they have done the major contribution and work, but he took the credits, or not indirectly, but this is how the work systems work. Okay, so I'm spilling too much of tea over here. You might just stop, want to do even PGs or the research, but that's how it works. Okay, that system works. Okay, now the main thing is that the pharmacology has the two major divisions. One is pharmacodynamic and pharmacokinetics, and that is very important. So this division tells us what, one by one we're going to see. Pharmacodynamic, dynamic means what? Power. Okay, which means what? Power of the drug. Pharmaco means drug dynamic means power. Okay, how vastly it can work and do the things. So means in pharmacodynamic, when the person is pharmacology and he undergoing pharmacodynamics, he's actually looking what? He's looking for the how the drug affects the body. Means, for example, I took the paracetamol, how the paracetamol working on my body? It is just relieving the fever or other thing also. So there are certain drugs which people take it for other reason and the hair starts growing up. If you know that, let me know in the comment section. It's a very interesting story of finding that drug, and I give you an example, like a hint that the name start with N. Okay, I hope you will be able to tell that in the comment section. Coming up to the next thing, that is that this is the first thing, and the second is pharmacokinetics. Kinetic word means movements. Okay, you might have studied the kinetic in the physics also. Okay, so it means motion. It means what? How the body responds to the drug and move it along with the body functions. Okay, so kinetic is for the body effect on the drug, how it is metabolizing and working and using it, whereas dynamic is the drug. So one such examples that could be like, for example, pharmacodynamic means you have taken what? Adrenaline substitute. So what it will do? It will go and it will interact with the adrenal receptors. So these receptors are present on the cell membrane. So it will go through the cell membrane. And now I told you what? Adrenaline is what? Since adrenaline will go and it will give what? A secondary response. You might have studied in your 11th class also that how these hormones are working. So adrenaline work like that. Its receptor is present on the membrane. The membrane will initiate what? Secondary messenger, that is cyclic AMP. And then it leads to what? It leads to cardiac stimulation, hepatic glyconeolysis, and the hepatic glycemia. So hyperglycemia, which means what? It will increase the respirations so that the more amount of what work can be done. Okay, this is what the function of adrenaline, because you know that when the adrenaline will be taken up in the body, what it is what it does as a hormone also, and its substitute will do the similar function. Clear? Next is pharmacokinetics. We can give the example like that, how we are taking a medicine and how it is easily absorbing, how easily it is metabolizing, how easily it is excreting out. Like for example, we often say that like if you are taking the paracetamol, take again after 6 hours. Okay, why do we say that? Because of that, how easily it get metabolized and excreted out from our body, and if the drug is excreted out of our body, means its effect will be reduced. We again has to take that particular part. So I hope you would be understanding this thing. And every chemical, you know that from the chemical kinetics in your 12th class you might have studied in chemistry, that how the half-life concept work. If not, that try to understand it, because that's gonna be coming up really a lot in your pharmacology topic. I hope this thing is understood to you, that what this and this means. Okay, moving on to the next thing, that drug word. Now the drug word, usually we use it like that in the wrong way. Okay, of course the things which they are trading for the effects on the body is actually drug only, and it is for the medicinal purpose, for calming down certain things. Like for example, when we'll be studying about certain pain relievers like morphine and all, which are being substituted in case of high intense pain, surgeries or the cancer treatments time, at that time those morphines, the person is like, we will study about it. So the person take it for the pain relief because it's give that feeling. How it is done and everything we will learn over there. Coming back to the major thing is that, but it is being abused by the healthy people also. You know this thing. So that is what, there is a certain things, the drug that has been abused or the electrical substance, we use that, but it is what in terms of it is a degradation or of the information and to the term that has been got. Okay, so earlier we used to say like certain terms which was like good, but we have degraded it to certain level that now we don't even feel like using it in that way, right? But in reality, drug is nothing. It is what? It is a dry herb. It comes from, it's a French word drug, okay, which is a dry herb, which is used for what? It is used to treat or cure the disease, for the treatment, prevention, curing of the disease. And according to the WHO, they have even said that the drug is any substance or a product that is used for an intent to be modified or explore the physiological system, pathological state for the benefit of the recipient. Recipient means the person who is taking it. Okay, that is what. But later on, it is used, like it is even start using up for the addictions, for using the illegal or electrical substances, right? So that is in the derogatory ways we have started using the term. I hope this thing is understood. Drug is a good word only, and for us now we know that since we are what? We are professionals. So as a professionals, we're going to be using drug as a drug, not as an abused substance which has been used up. Okay, so then there are other important aspects of pharmacologies and the terminologies which we have to understand. One is pharmacotherapeutics, which means what? We are putting all our information of the knowledge of the drug and giving it for the use for the therapy, for the medicinal purpose, okay, to cure the disease, okay, for the management of the disease or for the prevention of the disease. Okay, so it is what? Application of pharmacological informations together with the knowledge of the disease, which you gonna be doing it. In this chapter, you're gonna be studying about the pharmacological different drugs. In third year, when there will be journal medicine, you will be applying those things together and giving them medicine according to the doses. Those things we will study over here. Okay. For any cure, selection of the most appropriate drug, doses, and the duration of the treatment, taking into account the specific feature of the patient or the part of the pharmacotherapeutics. So we have to take care of all the things that, okay, this will work for this will. Why not we are giving ibuprofen, an example, for the fever? The question might be like this also. Okay, so this thing also we have to understand. Next is the clinical pharmacology. What is clinical pharmacology? It is the science which study the drugs, study of a drug, okay, in man, okay, and it includes pharmacodynamics and pharmacokinetic investigation in healthy volunteer and in the patients. So of course, when we are doing the clinical pharmacology, means we are trying to understand what its function and how it's going to be affecting the body, right? This is very thing. So we're doing all the things, means it's like what? It's a downstreaming process, making a drug understand first and making it suitable for the patients. So all of those things will be done in that. Okay, so evidence-based medicines are being employed into it. A very important question. These days, a doctor has been arrested, okay, for giving a certain syrup or recommending a certain syrup, okay, to the children's. The questions to us should be that whether it was doctor's mistake or it's the mistake of the clinical pharmacological unit or the committee which actually make a drug safer or the non-safer, or recommend it for the safer or not. That thing gonna be also coming up, that whether it's the mistake of a doctor or a competent authority. Let's just slowly coming upon that also, which is also what? Leading with this thing only. So evidence-based medicines should be there, that proper evidences of its efficacy, that how effective a medicine is, should be there. Okay, and how it is working, what is the pros and cons of it. Then only we can lead to the mass production of it. Chemotherapy, you might have studied it with respect to in your earlier school days also, that for the cancer treatment we are taking chemotherapy and the radiotherapy. So chemotherapy is just for that? No. Chemotherapy simply means that the chemicals which we are giving for the therapeutic reliefs. There was systemic infections, malignancy with a specific drug treatment which have a selective toxicity for infecting the organisms or the malignant cells which are not normal in the body. So that is what chemotherapy, okay, simply means when you are having any bacterial disorder or a physiological disorder where your cells are not normally forming or performing their work, we are giving what medicines. So that is what chemical you are taking to fight against certain abnormality in your body. It can be in terms of the physiologically in the cells itself, or it could be related to the infectious particle pathogen which has entered in our body. Then comes like drugs in general has divided into two: pharmacodynamic agents or chemotherapeutic agents. So now the term itself saying that pharmacodynamic agent means that it is designed for the pharmacodynamic effects in the recipient, means what effect a drug will do in the body, and second is it is made for the killing of the invading parasite or the malignant cells. So there are two different types of chemotherapy, like drugs that we are taking up. How you will understand it more? Pharmacodynamic word means that what the drug is doing on the body, means sometimes you need a relief in your body. Like fever is not bad for your body, it's good for your body, it's a defense mechanism, but that is doing what? That is making your own body also deteriorate. What happens? How happen? General pathology. Okay, here we're gonna be studying understanding only that fever we have to reduce it up. Here we are not killing anything. Here we are making our body to, like a drug, do something on our body so that it can reduce it thing. We are not killing it. But when we are coming to the killing thing up, so then it's a chemotherapeutic agent kind of a drug. So this is the broad classification. So when, for example, if you during this time a lot of like seasons are changing, so a lot of you might get what we say that fever and little bit of sore throat and all. So the sore throat is mostly because of the bacterial infection that has been taken place. But the fever is what your body is trying to elevate your temperature so that the bacteria is not able to survive. But if it keep on evaluating, it start deteriorating your enzymatic activity of the cells also, because your activity is maximum at 37 and little bit up and there, not more than that. You know this thing from the biomolecules chapter, that enzymes are very specific in functioning with respect to temperature and the pH. Coming back to that knowledge, little knowledge only we needed. Okay, so coming back to it, we understand that when you are giving a patient a drug, how you will do it? So you will give one paracetamol for the fever. Okay, paracetamol has the function to reduce the fever symptoms. Okay, and second, you will give what? Antibiotic for your sore throat. Normally erythromycin is given. Okay, so you give erythromycin, you give paracetamol. Okay, of course, if the doses are very high level, we even give certain things which reduces the stomach digestive issues also. So more better digestions would be there. Okay, so the heat would be less. So that thing is also being given, but we are giving the two medicines that has been given at that point of a time. You understand that how we have worked on it. Understood how we are doing it? Now coming on to the pharmacy. Pharmacy is what? Pharmacy is not your where you are getting this thing. Pharmacy is a science where the compounding or how much drugs to be given. That is an important thing. So pharmacy will what? You go to them and they will like, okay, you take this much, this much, this much. So same thing is all there. Pharmacy is what? It is telling that what is the suitable doses for administration into a organism. Okay, so we always used to like take 500 mg or take 650 mg like this. Okay, so this thing is over here, pharmacy. The next is the toxicology, which means what? Poisonous effect of the drug. So we have to take care, we have to take care of that how much toxicity could be produced, because every what we say that medicine is toxic. Like for example, for our dentist people, we often gave ibuprofen, okay, as a painkiller. Okay, whether we are doing what, like if the patient came and said that, okay, I have this swelling and something, so to reduce the swelling, reduce the infection, reduce the fever, we gave a antibiotic with a painkiller. Okay, but we say that don't take this too much painkiller. But there are certain smart patients which will take the medicines, but they will, after they don't know that, okay, this is the painkiller, this is the antibiotic, let's go ahead, because the swelling has gone, pain has also gone, we will not come up for the RCT or whatever the procedure, extraction or whatever it is, and we will keep on taking the painkiller. But the painkiller is doing what? It is highly toxic, so increasing the toxicity amount. And sometimes also what? Sometimes there are certain chemicals present which are more than the required limits. That also will be the poisonous. So we have to study the adverse effects of the drug, okay, depending upon the doses, that how many doses. So that's why we say that don't take more than these doses, you will get the toxicity. Okay, so this thing is there. Moving, this is certain terminologies that we have done. Now comes the drug nomenclature, which means naming of the drug. Now when we are giving a name to the drug, so it depends upon the levels. Okay, so how we will remember it? Now first of all, we know that drugs will be made in a company. So the company, what they are making, some chemicals only, right? So they give what? Chemical name. So first is what? First is the chemical names, chemical naming. Now in chemical naming, what happened? Like for example, there is a simple drug, propanol. Okay, but its chemical name is what? At one position there is isopropyl. At third position 1-methyl oxy propanol. This is its chemical name. Now think yourself, the chemical name, chemistry name is so big, okay, and its function, nothing is being able to understand, right? At the chemical names, you can't tell about the properties of anything. So this is what it is very tough to remember. Even it's such a big one, how someone will tell that, okay, I am making 1 isopropyl 3 1-methoxy propanol. Think about yourself. It's just like that, a long South Indian names where the father, grandfather, great grandfather name is also being added up in the major name. Certain names you might have studied, okay, like that thing happened, such a big name. Okay, so we always make it what? Smaller. So the company also said that, okay, I will also make it smaller. How they did it? They gave it certain what? They gave certain code words for it. Even they did what? Like RO 15 17 88. Okay, and they give this code word for what? For fumagil. Now the question is that since they are giving this, it is okay at your level until it has came into what? Into the market. Later on we need what? We need a proper proprietary name, which means that जिसपे किसी का हक हो, ठीक है, ऐसा नाम रखना है which has a trademark to it, right? So late until that thing came into the market, these names can work as a chemical names. Okay, once in the market, they has to be given what? A proprietary name. Okay, so then comes the second thing, but do everyone has a proprietary name? No, there are certain non-proprietary names. Proprietary names means the brand's names. Before coming to brand also, certain namings are given up, and that namings will help us to understand. Like Frimazil is what? It is one of the non-proprietary name, which means what? There must be certain organization, and we need an international organizations which will give what? These non-proprietary names, so that they can later on do what? They can later on identify that, okay, this is the one you can go and buy from any company, but this is the basic name. Okay, so we used to often call it generic name, but since sometimes the generic word would be what? For certain thing it would be misinformed. Okay, so we always say that non-proprietary names. Okay, so non-proprietary names or naming. In this, what we're gonna coming up? We're gonna be coming up. Every country has organization. USA has, British has, India has. but we're going to be studying about what the WHO is, because all the countries are under the umbrella of WHO. Okay, every country is the part of WHO, right? So WHO countries has recommended international non-proprietary non-proprietary naming unit, which is RIND for drugs or the medicines. We're going to be using drugs means medicines. Okay, don't take it in a wrong way. Naming, which is accepted by all the countries as a same name. Okay, certain drugs still have two different names. Okay, before that, the important thing to remember is that since they provide a name based on rules accepted and acknowledged everywhere, and even banned drugs, right? They tell the future. Certain drugs still uses older names instead of newer name. Example which dentists will be using a lot, that will be a local anesthesia, that is lidocaine, or it is called as lignocaine. Same, there are certain more drugs also where still the older names are prevalent in the market. Okay, is it wrong according to the international non-proprietary recommended namings? Yes, but we are still using it. We don't call it generic names. Why we don't call it? Because it can be misinformance. Okay, and the third one is the branded names, which is called as what? Proprietary names. Proprietary naming, which is what? Brand names. Now brand give multiple names. Okay, the brand has what? Different brands are giving different name for the same medicine. Okay, so you know that they say that okay, the brand is different, the name also little bit change, because they are what? Trademark. They put a trademark of the naming. So this happens. Now when it comes to proprietary naming, means the branded namings, so same brand can have a different name also there. Okay, so in proprietary naming, different brands have different naming for one drug, as it is trademarked to them. Certain brands even have different name for same drug, okay, in different countries. For example, the company which is selling Tim Optic, okay, the company selling timolol, which is what? Eye drops as by the name Tim Optic in USA, sells by the name of glucomol in India. So means one country, one same brand is doing this. Okay, so moving on to the next one is that certain brand even give the names on the basis of which gives the or tells what it does. Okay, so certain naming is based on feature or function of the drug also. Example, for example, there is a medicine named low pressure. So low pressure means which reduces the blood pressure, means for the treatment of what? Hypertension. Simple, right? So example, low pressure, this is the spelling. Okay, used for lowering the hypertension. So like this they give the name. Okay, so when it comes to branded names, it is their marketing strategies that more work. But everywhere the solution, the like common thing that they are making inside it will have what? A non-proprietary name, and of course there will be a this name. So this name is what? The branded names, okay, which are being given. Okay, next we have drug compendia, where we're going to be studying about what? We're going to be studying about the what are the compliance of the drug in the form of a monographs. So means like this drug, this thing, means if you are getting a drug, what it does, what its effects, how much doses and everything to be written in certain form. That is known as what? Drug compendia. And there should be certain way where it has to be comprehended for all of us. So here we have to study the two different things. One is pharmacopoeias and other is the formulas. Pharmacopoeias are telling what? They are telling us about everything which is needed in terms of the drugs. So when we need everything, like every information that is needed, like that, how it is being formed, its chemical nature, what process it goes through, mode of action, and everything has been given over here about the drug. This is very important with respect to the authorities, okay, that how it is being made. It is very important for the brand to prepare it again and again and make it suitable. It is very important for releasing in the market, but for the doctor point of view, it is of no use. Okay, so this pharmacopoeia is what it is from the point of view authorities and everything. For example, India, every country has its own authority to regulate and keep the check that okay, whether they are making the right drug or not and what they are doing. Okay, so that thing has been done. For India, we have what? IP. For British, we have also there, I don't remember the name of their organization, but for India, it is IP. Okay, so Indian pharmacopoeias, okay, are there. So this thing we have to remember. So Indian pharmacopoeia is with what term? It is in the terms of that what drug is. Okay, so tells everything about drug from making, chemical composition, effects, clinical trials, etc. Everything, okay. Useful for what? Useful for the authorities, okay. Useful for brand companies company and authorities, but of no use to doctor or the physician. So for us, it is of no use. Okay, like regulatory body of India is what? IP. Coming up to the next thing, formulas. Here every magic happens because formulas are the basic requirement that we need it. And means as a doctor, as a dentist, means it is what? It is a kind of a booklet. Okay. So formulas are what? It is a kind of a booklet where about the drug, everything like what would be the doses, what would be the timing, at what interval we have to give it, what is the reaction, what drugs to be prescribed together or not with, what would be its adverse effects, its management, side effects, everything is written which is useful for us because we need what? We need about the dose, how much dose we have to give it. We need to tell about the effects. We need to know about if we can combine it with certain drug or not, or we have to even know that what would be its effect on the body. So this thing we need to know. Okay, so booklet. So formula is about booklet containing information about the drug, effect, uses, doses, amount to be given to recipient, amounts to be given, etc. from a patient point of view. Okay, so it is useful for doctors or physicians. Now, more than this, what are the other comprehended books that would be available? The other book, like for example, one such book that would be is the Martindale. It is what? It is a comprehensive book by the Royal Pharmacological Institute or the organization in Britain. Okay, what they do? They after every 2 to 3 years, releases or publish the all known old plus new drugs, effects, and possibly everything. Okay, so that the organizations or the people would be updated that okay, these are the new drugs that came up, this is the new thing that has taken place, this is the old drug which has this bad effects, and now we have banning it up. So this thing would be there. Same, there is what? There are other things also where they are doing what? They are even going further and tell like it's of no use to us, but they are like in the US and other thing which is also keeping a track of these similar things also. With this, we understood what? That about the information of drugs is present and comprehended as a drug compendia, which has a different types. Certain thing is good for the doctors like formulas. Certain thing has no use with the doctor but with the use for the brands and the authorities to understand it. That is the pharmacopoesis. And certain other institutes or certain other countries has certain unbiased. Okay, so this is very this is very important that this is what? Very unbiased. We consider it as very unbiased. It tells the truth without putting any drug company or country onto the shape. Clear? So this is about the drug compendia. Certain more as terms or concepts we have to know it, that when we are giving what drugs, so there are certain factors we have to remember, and WHO tells that these factors has to be remembered before administrating a drug. So administrating a drug, certain factors we have to remember, that any drug which come into the market, these are the certain points, so we will remember it. So what are the criteria? That the educate data on its efficacy, that how effective it is, and safety, how safe it is, should be available from the clinical studies. Means like you remember that when there was a COVID, at that time coronavirus were made. So sufficient data should be there. Data should be there to assess it. Okay, so that is the clinical studies of that drug has to be done on the clinical subject, on us, that what is the long-term use, what are the long-term effects. So we are still learning about it. Then it should be available in the form of which quality includes bioavailability and stability for the storage can be assured. It should not be like that you give it and within 30 minutes it's getting destroyed. So whether it will be even able to reach from the company to the consumers. Okay, so it's how stable it is. You can store it or not. How easily available it is. Okay, and like you can make it or not even. Okay, and what quality of it is. Okay, whether it's how much potent it is, or whether it's just like you have made it don't even have a 60 or 70% efficiency also. So this thing, then the choice should be depends upon the pattern of the prevalent disease, availability of the facilities and the trained personals to use it. Okay, financial resources also make an important role. Genetic and the demographic and environmental factors also matters, that whether that thing would be available. Like quinine is used for the treatment of malaria, that how it is available to the different countries. Certain drugs are available to the certain countries only because of the certain plants that is available over there, or certain organism is available over there, or endemic to that area. Okay, so this thing is also has to be assured that we can even mass produce it or not. Maybe we give it to the audience and then later it's not possible to be do it. Then in case of two or more similar medicines, choice should be made on the basis of their relative efficacy, safety, quality, price and availability. So means like if you come up to me, for example, there is a medicine amoxicillin, very common one. It is available for very like few bucks only. Okay, but we have what a very potent one of it, which is more effective or which has certain extra chemicals present into it. That is amoxiclave potash. Okay, which is what, which is more effective, more potent. Okay, efficacy is more, but the cost also increases. So when the similar kind of drug is there, so I will look into it whether the patient is able to afford it or not. Okay, so that thing also it do role, cost benefit. Okay, all these things come up. Then the choice may have been influenced by the comparative pharmacokinetic properties and the local facilities for the manufacture and the storage. Means whether how the drug is being doing, like on the like how the body is able to process it. Okay, or maybe that how much rules I would need it in. Maybe for example I took a drug and that drug is metabolized like like in my body, the half-life of everything is of few minutes only, and within 1 hour it can be reduced from, and outside from the body by evaporating by the sweat in the summertime. Okay, then I have to take it again for 1 hour, after 1 hour, then throughout 24 hours I will be taking 24 times doses. No, it's not correct, right? So these things are into my mind. Okay, then most essential medicine should be of single compounds. Okay, mixed ratios won't be there, because that will what, that will cause a drug resistance also, because we want that one drug to be given to the patient, so that if any resistance is being formed, resistance means like my body stopped responding to that drug, I have another substitute of it so that I can give it. But if I'm using two different substitutes simultaneously, it will do what, my body will become resistant to both the drugs. And what if the market is only two drugs available? Problem. So that thing will work. Then selection of essential medicines should be a continuous process which should be taken into account by changing the priority of the public health section, epidemiological condition, as well as the ability of the better medicine formula and the feature. That is also there. Like that's why I keep on changing the medicines that I am being giving to the patients. If our long-term patient is a family patient is there, after a certain period of time, I might change the medicines. So does it happens when we are treating the tuberculosis. We will learn it. That will come also in our syllabus. Okay. Then recent it had been emphasized to select essential medicine based on the rational developed treatment guidelines. Means a proper protocol is there. So those medicines has to be used up in that way only. We are coming up with the answers of the questions, that what would have happened with the doctors in terms of the cup syrups. Okay, lots of answers are coming up. Moving on to the next thing. Then there are what? There are prescriptions and non-prescription drugs. Very simple. every country has a rules and regulations that certain drugs which are not very potent can be given without the prescriptions. Over the counter drugs are there. Any pharmacy person, chemist can give it, right? But there are certain persons, okay, or the certain drugs which is only being given when you are giving it in the writing. Okay, a doctor is recommending it. So doctor's point of view come into play over here. So this thing is also there. India has its own set of rules, okay, for the drugs, and that is in the schedule H in our constitution have different schedules. So one such is schedule H of the drugs and the cosmetic rules in 1945, which is later on amended also tells that fewer drugs like simple analgesic means pain relievers like paracetamols and aspirins, okay, antacids, okay, laxatives and the vitamins, ferrous iron medicines. These we can just, they are not that harmful, so we can just give it like that only. Over the counter we can give it. They are non-prescriptory drugs. Even the grocery stores can keep it. But certain orphan drugs, like certain non-prescriptory drugs, certain prescriptory drugs are there. Okay, that also we have talked about. Then we have orphan drugs. These are those drugs or the biological products which are used for preventing a disease or for the treatment or for the diagnostic of very rare disease. Okay. And that takes place in the country which are endemic diseases are there, or spaces where because of their country's poor conditions. Okay, so certain drugs are not marketed over there to get the benefits, but to help those countries. Okay, so those drugs are called as orphan drugs. Okay, so for example, if we didn't give these drugs like that, then what will happen? Those poor country patients won't be able to even survive. Okay, so these are the life-saving drugs for the patients. And if we make it commercial use to it, it will becomes unviable for the patients to take it. So even certain countries give certain incentives or subsidies on that. For example, even the US has Orphan Drug Act in USA. So we also give certain medicines to certain countries like Afghanistan and many other countries. So does other countries also do it. Okay, so this is the concepts of it. Okay, moving on to the next thing, the second part of the chapter, that is the route of the drug administration, that how we're gonna be giving the drug to the patient. So in the routes, we have two major, the local and the systemic. Local means that at the localized area we are treating it. We are not treating it on the far off part of the bodies or different part of the body. We don't want to treat it. We want to treat at a particular location. For example, if the cut is here, we will put the band-aid here. Not whole of the plaster we will do it, right? So same thing. So the local is like that. So local has three parts. One is tropical appliance ones, deeper tissues one, or the arterial supplies one. So now the first one is the local in the tropical. So tropical means on the above. So here we are doing on the above surface. We don't want it to go deeper. We want just keep it to the initial layers of the cells. Means wherever the epithelial cells are present. If we want the epithelial layer, basement membrane, or the subcutaneous layer, that only to be had the function, then we put it tropical ones. For example, ornaments, you know that we use ornaments like we use the ornaments like the creams and jellies and so many things over here. So they are the tropical ones. Okay, you understand it. Even the tropical ones were tropical ones, like for example, you are using the like at your level, at the dentistry level, for example, we used to spray the lignocaine, right, on the upper mucosa or somewhere, so it will just numb it up. So we can even do it with the skin other part also, right? So this is the tropical ones. Then the deeper tissues means inside and penetrating the skins or the other layers. For example, if you want that your bronchi inner tissues, okay, means for example, this is the bronchial and this area of the bronchi to be getting the medicine because of certain misfunction over there or the problem over there. So we do what? We gave it what? By inhalation, so that it reaches in that area. So we inhale the air with that medicine will go inside it. Like for example, salbutamol. We give it for the bronchial issues a lot of time. Okay, same goes with if there is what a rectal hemorrhoids or something like that, pain is there, so we give the lignocaine for the treatment of that. So that is what the deeper tissues. Moving on the arterial supply, where we actually do it. So if there is any malignancies, like for example, we give the injections. Okay, arterial supply injections like angioplasty we are doing, sorry, angiography we are doing. At that time also we are employing the closer to that blood vessel where we're gonna be doing it up. Okay, so we give the arterial injections into it. Okay, even for the like we have femoral injections when the leg related cancer malignancies are there. In the deeper tissues there are other examples also, like for example, even your like local if within the nerve area is there, we gave a local anesthesia, but the side by tissue also we want that maybe there can be nerve endings that would be deteriorated while doing it, pain would be there over there, so we put it the infiltration over there. So that is also the part is what deeper tissue local type of drug administration. When it comes to systemic ones, we have broad variety of the things, because we want what? That our blood vessels to soak up the things. Okay, and it goes to one part to other part. Okay, coming on the first, that is the oral. Oral is very easy. What is there? Oral means through mouth. So the most of the medicines that we are taking is through the mouth only. And when I'm saying that most of the medicines we are taking through mouth only, so what would be the issues with this? So first of all, when we take certain medicine, we just like drink water, right? Or we take, certain people even like eat it and then take the toffees or need something sweet, right? So means what? That the taste would be the major problem. Okay, that not all the people can have it. Next, to take it, person has to be unconscious. If the patient is uncooperative, means not cooperating, unconscious, if it is like so how you will put medicine and it will engulf it? That swallowing is a what? A voluntary thing, right? So it won't go there. So patient would not be able to be affected with it. Plus, what else would be there with this drug thing? Other issues like that if you take it, the drugs, certain things, certain drugs can even be metabolized or will be destroyed by the HCl. So we have to protect it also over there. So what could be the one thing could be done? So for example, certain times like if the drug is very unpalatable, like chloroamphiphilol. So in that case, what happened? We put it inside the capsule. The capsule get digested and then it shows its effects. So the bitterness is avoided like that. Okay, so this thing is done. Plus even like if it is not being destroyed by that, then the liver will release the toxicity, because liver is what? Detoxificant. So all the thing which will be absorbed in the blood, it will go and bypass like the liver. So these things were the major issues with the oral thing. Okay, that oral medicines is not that effective. Okay, so oral we understood that most of the medicines are that, and what its side effects. So we have what? Understood it. Okay, so important thing is what? Demerits of oral we understood. Okay, next come what? Sublingual or the buccal. So here we what? We took it, the medicine, we put it under the tongue. So from here directly into the blood vessels, the medicine is being taken up. Okay, now how important it could be? So you know that certain drugs are there which we take it orally, it will be digested by the gastric juices. So we can't take it like that. We want to put it in the bloodstream, because blood will go into, those drugs will go in the blood in the intestine only, when the absorption will take place with the help of microbiology. So we will do what? We will give it by the buccal or the sublingual. When we are giving stuff like for example what? GTN. Okay, we give it sublingually. It is easily working over here. Okay, so we are giving this what? Sublingually. Other than this, we have buprenorphine, we have desamino, spelling, desamino oxytocin. Okay, oxytocin. This we were taking what sublingually because it help in what? It help in bypassing the digestion process and it directly goes into the blood vessels. Okay, more faster. Then comes the rectal ones. So who we can take it rectal? So first of all, what is that? It is through the anus. We will put it in the anus, and the through rectum it will be absorbed in the body circulation. Here also we are bypassing the liver and the digestive juice and everything. But what problem is there? Think yourself that if you are putting your medicine instead of mouth into your anus, it is embarrassing, right? But where we do it? We do it with the children's. Where we can do it? Children's are the easiest suspect. If the children is not able to take it by the mouth, put it in the, right? So here which medicines we usually give? We give estradiol, sorry, not the estradiol, argitamine. We have argitamine. Okay, we have paracetamol. We have diazepam. Etc. Few more medicines are there. We take it by the rectal way. Next is cutaneous. Cutaneous means what? Through skins. Okay. So subcutaneous, we try to think that it absorbed. So here we use what? Here we use the transdermal patches. Transdermal patches. So you might have seen certain patches with the white color on one side with the hole present on it. That is transdermal patches. Actually the holes are not directly present. So one is what? That this is the, if for example, if it looks like something this. Okay, imagine it. Okay, it is like this. It is in the square, 2 different centimeter square it is there. Just imagine for now because I have this now. So it will be what? On one side there will be a protective film present, other side it will be plain. If I will remove this protective film, I will be able to see that white color with the holes. And it has adhesive. It gets pasted. For example, I want to paste it, it will be pasted like this. More better absorption rates are there and more better compliances with terms of patients are there with it, because those medicines which they are not able to take orally, they are ready to take it like that, patients. Okay, we put it like this and they take it. Now over here what happens? So if we will take it out, there is what normal biofilm on this medicine layer is there, coating is there. Then that white with the whole porous membrane is there, Through this, it is controlled amount of medicine will be keep on seeping inside what? My skin. So this is what? Transdermal patches. Okay, for us in India, there is fentanyl patch is available, nicotine patch is available, GTN patch is available, and estradiol patch is available to us. Okay, in other countries more than these patches are available, but in India these are available. In India these patches are available, so we can give it better. Okay, what would be the problem with this? The problem would be if you paste it over there, okay, there might be erythema, inflammation could be there, redness could be there over there. Okay, most probably. Okay, because of the putting it over there. Then inhalation. Through inhalation also we take certain medicines which is effective. Okay, especially what? Especially the anesthesia. So the general anesthesia work by the inhalation itself, because through that it just directly get absorbed into the blood vessels. Okay, and easily passed to the everywhere, pumped to everywhere. Then through nasal, certain nebulizers we have, okay, which had its effects. Okay, so we have nebulizers and other which can be taken from the nasal. So like we can take it. Okay, so this is it. And the last one is parentals. Okay, Para-eternal means that beyond. Eternal word is for the intestine. So you are crossing the intestine and then you are doing it. So here you are not even letting the intestine or the GIT to come into its way. You directly putting the things closer to the blood vessels where there is a rich supply of blood vessels. So there are 4 different ways: subcutaneous, intramuscular, intravenous, and intradermal injections. Let's come to subcutaneous. Subcutaneous means that upper cutaneous layer, like under the skin, subcutaneous layer are there. There we are injecting the things. So we have what? We have like the way of injecting the drug is there. We have dermatojets, we have palate implantations, and the salicylastic or the biodegradable implants. So this is what? This is biodegradable implant. Now the dermatogen, here what happened? Like it's kind of a very like it's not painful at all. Okay, mostly it's not at all painful. So directly people like high velocity drug we directly inject into the derm. It's not that invasive. Little bit of course all are invasive techniques only. It will go through your skin. Okay, but in this dermatogen it don't cause that much. Okay, so I hope dermatogen is understood. Then comes the palate implantation. So in this a solid palate is being made and directly injected into the implantation with the help of an instrument like trochlear and the cannula, and it is implanted over there. Then we have salicylastic or biodegradable implants where they are made up of certain things which slowly in your skin dissolve completely, and that has a certain life frame. For example, Norplant, you might have studied implantations in case of for the pregnancy avoiding things. Okay, this is what subcutaneous, putting the things into your body under the skin layers. Okay, then we have intramuscular through the muscles we are putting it up, and here we are doing what? Mostly your pain relieving or the other vaccines kind of a thing. So in this intramuscular we are choosing what? Deltoid muscle, triceps muscles, or the gluteus major muscles, means your hip muscles, where we used to put the injections. We always used to either injections are put here or in here, or in the femur also femur muscle is also being put over there because of their higher vascularity nature. They will be directly absorbed into the blood vessels and give the relief. Moving on, the next is the intravenous. Intravenous is the most of the the riskiest one of all of it, but it is what? If it is given in the right way, proper conditions are being maintained, then this intravenous, even the small amount, will give the potent response. And the risk factor is immersive because all the major organs are directly in the connect of your veins or the blood vessels. So basically in this what happened, we find the vein, we puncture the vein because these veins are available. Upper more are the veins, arteries are present deeper. Okay, so these veins we directly put the injection into it and we release this thing. Now here only comes the major of the problems and the complication and the risk factors. One risk factor, I have already told you that all the organs are directly in contact with it. So the amount of drug to be very much regulated. If we give it more or extra, there will be drug toxicity with all these glands or any effects can happen on them. So one thing can like sometimes what happen, if the doctor has penetrated it, and if that penetration is not proper or any issue is there, then thrombocystitis can happen, which means what? That your blood vessels can be inflammation. Even that if sometimes someone give it and it keep on going and it just make it what? Go through it, then also what? Hematoma and other things can form up. Even the swelling at that area can form up. Even later on what? Later on even the air is present, so embolism can also happen. Okay, so air embolism can take place. What are these terms? In the journal pathology you will study that. Okay, so that is the major thing about the intravenous issues with it, but highly effective one. And the last is the intradermal injections, where you do what? Here you raise the skin little bit and then you will inject the things. So your allergy test is like that. Okay, so you raise the thing, okay, raise your skin, make a flare out of it. Same thing you do it with it. Like for example, BCG vaccine is also being administered like this, but this intradermal injection is very much, what we say that, for very much restricted for certain procedures, or like the skin allergy test, or the allergy test, and the what we say that BCG vaccine administration, and few vaccines only administration, this thing has been used. With this, we have completed all the things about this chapter. One thing about the parental route is also there, which you're gonna be studying later on. That is that what is the angle of administration of these things. So if it is a subcutaneous, we give it by 45 degrees. So if this is the injection and you are giving a subcutaneous layer only, then you will give it like with my body, like with this is my base, you will give it by an angle. For example, this is the subject. So this is the 40-degree angle. So you will take the injections and you will inject at this. Okay, so like this way, this is what 45-degree angle, but means subcutaneous if you have to give it. Okay, but if you have to give it to me the intramuscular, then you give it 90-degree like this. So means if you are giving me injection over there, the 90 degrees like this. Can you see that this is the main body, this is the 90-degree. So this injection is like that. On my buttocks, if you have to give it, you will give it 90-degree to my body. Then if you want to give it intravenous, means over here, then you might have seen that the doctor has taken like this. They put it like this. Why? Particular reason, so that don't go like this. It comes like this. It goes inside your vein only. So 25-degree, very downward. And if it is intradermal, then we go like very down, 10 to 15-degree, very downwards. So normally over here it is being done like this, very downwards. Okay, so this is the angle you have to remember. Okay, next, with this we have completed the chapter, and there is a one question for you. Okay, so I will explain you. Before that, the limitation of oral routes, we have already done it. This is certain facts also given to you. You can go through it, take the screenshot of it, and this is a different way to remember it, what to give, how to give, and what kind of things you can do it. Otic is through ear also we do it, so that is a tropical only. Then ocular is by the eyes, nasal is by the nose, oral is by the mouth, inhalation, you know that, rectal, vaginal also, vaginal things is also there. Okay, and the injections are there, and the transdermal patches are there. Moving on to the major thing, that is the question of the day. Okay, so the question says that you have a 5 साल का बच्चा है आपके पास, ठीक है, लेट्स कम्स टू 1-on-1 एंड उस 5 साल का बच्चा जब हॉस्पिटल में आया तो उसके पास फीवर है, कफ है, ब्रीथलेसनेस है, बच्चा इज नॉट एबल टू ब्रीथ. ओके, चेस्ट में पेन भी है, ठीक है. तो ऑन एग्जामिनेशंस ही इज फाउंड टू बी डल. सो लाइक दिस कंडीशन इज देयर. इरिटेबल है, बहुत ज़्यादा रो रहा है. 5 साल का बच्चा क्या करेगा जब ऐसा फील करेगा, है ना. देन फास्ट पल्स है, आपने पल्स चेक करी, फास्ट है. एंड ब्रीथ भी रैपिडली कर रहा है क्योंकि ब्रीथलेसनेस है, अच्छे से ब्रीथ नहीं ले पा रहा है. तो वो भी 50 पर मिनट्स हैं, ठीक है. नॉर्मली कितनी होती हैं जल्दी से बताओ. ये तो 11th क्लास में भी पढ़ा होगा. एंड लोअर चेस्ट पे इंस्पिरेशन का पता चल रहा है, वीजिंग है, आवाज़ आ रही है, क्रिप्टेशंस हैं, माइल्ड डिहाइड्रेशन भी है बच्चे को, ठीक है. तो दिस इज़ वेरी इंपॉर्टेंट, डिहाइड्रेशन. बॉडी टेम्परेचर जो है वो 40 डिग्री है, मीन्स डेफिनेटली उसको फीवर है, हाई ग्रेड फीवर है, 104 डिग्री फ़ारेनहाइट. द पेडियाट्रिशियन मेक्स अ प्रोविजनल डायग्नोसिस ऑफ एक्यूट निमोनिया हो रखा है बच्चे को, लंग इन्फेक्शन है. एंड ऑर्डर रेलिवेंट हेमाटोलॉजिकल एज वेल एज पेक्टोरिकल इन्वेस्टिगेशंस, कि भाई तुम आप लिख दिया उसने कि भाई ये सारे टेस्ट करवा लो, बट उसने डिसाइड किया कि वो एंटीबायोटिक थेरेपी देगा. ऑफकोर्स देना पड़ेगा, अगर निमोनिया जैसा लग रहा है, फील हो रहा है, तो आप एंटीबायोटिक थेरेपी ही दोगे, राइट. इन केस ही सेलेक्ट्स एन एंटीबायोटिक, ठीक है, which can be given orally as well as intramuscularly और intravenously injections. हर तरह के उसके टाइप हैं. कौन सा रूट आप इस बच्चे को देना चाहोगे? तो सबसे पहले आ जाता है इसके क्वेश्चन का एक अंडरस्टैंडिंग. तो आप अगर हो तो आप क्या करोगे? तो सबसे पहले तो देखोगे कि चलो एंटीबॉडी देना है, ओरली दे नहीं सकते. पहले बात तो बच्चा है, उससे भी ज़्यादा क्या है, इरिटेबल है, मुंह से खाएगा, थूक देगा. This is what the patient will do. Patient will directly spit it out with a child, or maybe even vomit it out, right? For a child of 5 years. So what you will do, and normally the bacterial medicines like antibacterial medicines are bitter in taste. Okay, so you will either go with intramuscular or intravenous. Now since the baby is highly, you can see that so much of features are there. Okay, it's a one of the very strict conditions. So you will say that I will go with intravenous, but here comes the major thing, that is a mild dehydration. Mild dehydration case means what? That patients don't have enough of the water content or the electrolyte content in the body, which means that when you try to give the things inside the body, there might be an issue. What is that? You will learn it. But let's just take that. So we won't be going with the intravenous because of these reasons. We will want that the patient to be completely hydrated. Then only intravenous injections can be given up. So we will go with the intramuscular injections, mostly at the buttocks. Okay, so that is the gluteus muscles, major muscles. So that will be taken up. And comes the second question, that is, should the pediatrician or maybe the doctor administrate the antibiotic straight away, or should he wait for the laboratory reports? That I will leave it on you, what that you will do it. You can give it in the comment section and I will explain this answer in the next video super soon. If you like this video, give me a like. Don't forget to subscribe and share it with your friends. Let me know that what thing I told you correct, or if there's any issues in the way I present this topic to you or my understanding to you. I am up for all of this thing in the comment section. Let's just see you and meet you for the next video super soon. Thank you.